But one of the questions that people still have is, if they've already had COVID in the past, do they still need to get vaccinated? Because what's the difference between getting an immune response to COVID and to the vaccine? Could you help us just address that question? It comes up a lot still.
So that's an excellent question, and that is a question that I'm getting all the time in clinic as well. We know that a natural infection does entail some immune response and some immunity. So it's less likely right off the bat that if you get COVID that you're going to be infected with COVID a second time right away. Natural infection and the vaccination entail kind of two different kinds of immune responses, and we know that when comparing the two of them, that the vaccination response tends to be much more of a robust or kind of significant response to the vaccination, and we know that the response is actually more protective, so protective against severe infections, and tends to be more long-lasting than the natural infection. And so even for people who have been infected, I'm still encouraging them to give their immunity a bit of a boost with getting the vaccine as well.
So kind of what you're describing is that our immune systems have lots of different ways that we fight off viruses, bacteria, other things. And what the vaccine is doing is targeting different parts of our immune system in certain ways than when we're exposed to the virus out in the world. And that having that extra vaccine immune response is really beneficial, even if you've had that, regular exposure. Is that kind of fair to say that's what's going on?
Absolutely. And along with that, we're also currently evaluating with studies whether or not the natural infection also provides protection against the new variants that are coming out as well. And so it's not really clear whether if you were infected with one of the previous variants of the disease, whether or not you are protected significantly against the Delta variant, which is the most predominant variant right now.